Welcome to the Health Channel, all health, all the time. I'm Kathy Buccio, coming to you from the Baptist Health South Florida studios. Strokes are one of the leading causes of death in the U.S. In fact, 1 in 6 people will have a stroke in their lifetime. But did you know that 80% of strokes are preventable? And today on the Health Channel, we'll be talking about how to reduce your risk for stroke, including different lifestyle modifications. And later, we'll also be discussing the link between stroke and dementia, and how you may be able to prevent both of these neurologic conditions. And joining us today is Dr. Felipe de los Rios, neurologist with the Baptist Health Neuroscience Center. Welcome, Dr. de los Rios. Thank you for being here.
Hi, Kathy. Thank you for having me.
Okay, so let's start off by talking about stroke. So what is a stroke and how often does it occur?
Sure. So stroke happens when there's a lack of blood flow to the brain. So the brain receives nutrients, oxygen, glucose, things it needs to live from arteries. And whenever there's a lack of that flow of nutrients, then the brain will start suffering. If it doesn't receive it for long enough, then you'll have some permanent damage, and that's what we call a stroke. And it's very common. So 1 out of 6 people will have it throughout their lifetime. Actually, 1 out of 5 women will have it throughout their lifetime. So it's a little more common in women.
Is there a reason why it's more common in women?
There might be a couple of different reasons. Hormonals, there's different things that play into that.
Okay.
And they also live a little longer, and stroke is a disease that's more common as we age.
Mm-hmm.
So that's also part of it. But it's the 5th leading cause of death in the US, like you mentioned. And it's also in the world, though, it's the 2nd leading cause of death in the world.
Frightening.
And one thing is dying from the disease, but the other is the disability. So it's a leading cause of living with disability or years lost due to disability.
And now there are 2 different types of strokes, correct? It's a hemorrhagic stroke and ischemic stroke. So what is the difference between the 2?
Right. So there's actually 3 different types of strokes. These are the 2 main ones. Ischemic, where there's a lack of blood flow to the brain, and hemorrhagic stroke, when a blood vessel ruptures, and then you have blood going into the brain tissue itself. And ischemic stroke is about 80% or 85% of all types. Hemorrhagic is about 10-15%, and then about 5% is subarachnoid hemorrhage, when an aneurysm ruptures, and the blood then goes not into the brain itself, but between the brain and the lining, which we call the meninges.
So what causes these 2 main strokes?
So the ischemic stroke and the hemorrhagic stroke share some common risk factors, both of them together. The underlying mechanism is damage to the arteries themselves. So different things can damage the arteries through life: high blood pressure, high cholesterol, aging itself, tobacco. So we're going to talk into details of these things that you can modify. There's some genetics as well. But as the arteries get damaged, then they get prone to either forming clots on the arteries, or blocking altogether, or rupturing, and that's when you have the bleeding.
And what do you see more of? Do you see more of the ischemic, or you see more of the hemorrhagic stroke?
We definitely see more of the ischemic. So that's about 80% or so, and then when there's a lack of blood flow. So and that's the one that we have the best therapies for. So
for the ischemic?
For the ischemic, correct.
And now, since ischemic strokes are more common, let's take a look at our 3D image. We have a brain that shows signs of an ischemic stroke. So, Dr. de los Rios, can you explain what we're looking at here exactly, and where are we seeing that rupture or that blocked vessel?
Okay, so this is the brain tissue, and these are the arteries here. So the arteries are bringing blood to the brain and feeding the brain. And if you have any blockage of any of these branches, then that specific area will get damaged. Here you have the carotid bifurcation. So this is the carotid arteries here on the neck. And what you see is there's some fat buildup here. So the artery has been open for the diagram here, and you can see there's fat buildup. And clots can form on this fat buildup, as we call it, a ruptured plaque, and it can travel up and then lodge. So here you can, I don't know if you can see it on the screen, but here there's a small clot, and then there is this area of the brain that's a little darker because there's no blood going into it. So if you don't restore blood flow and remove this clot so this area can breathe again, then that area dies. There's a number of hours, sometimes a little longer, sometimes even up to a day,
Right.
that the tissue can survive without the oxygen supply it needs, but after that, then it's irreversibly injured.
But the more time you wait, the more damage is done.
Correct. So the longer you wait, the more injury there is, the less brain tissue you can rescue with our therapies.
Right.
So
Now-
time is very critical.
Dr. Dos Rios, so basically, just to reaffirm, this stroke started because of that artery.
Correct. So in this case, there was this fat buildup here, and a clot formed to try to repair that artery that's damaged from that fat deposition. And the clot formed here, and then it migrated up downstream into the brain.
Right.
So we call that a thromboembolic stroke, versus strokes that would form within the artery here, for example, like a blockage there in
Right.
itself, and that will call a thrombotic stroke.
And a hemorrhagic stroke would look like a burst, correct? Instead of a...
Yes. So in a hemorrhagic stroke, one of the arteries will have a hole, and blood would gush out. It's kind of like flood. If you have some blood, you need some blood, obviously. Like if you have in your house, you need water. But then if you have a flood, then damage happens, and that's exactly what happens in a hemorrhagic stroke. There's a small hole, the artery gushes out too much blood, and you get injury.
Now, you hear sometimes people say they had a mini stroke or a TIA, which stands for transient ischemic attack. Now, are those the same thing? What does that mean, a mini stroke?
So a mini stroke is when there's an area of damage, but it's very, very small.
Okay.
And you might or might not see it on brain imaging. So that's a mini stroke. A TIA, by definition, there's no injury. So there was a lack of blood flow to an area of the brain. The brain didn't function very well during that time period, so the person has symptoms. But then the blood flow is able to be restored. Your own body has mechanisms to destroy clots.
So there are two different things.
There are two different things.
Okay.
Many times people will mention them interchangeably, and sometimes a physician might do that as well just to simplify things. But a stroke is an area of damage. And the TIA, there wasn't brain damage. So the person returns fully to what he or she was before the symptoms started. Usually lasts minutes, maybe a couple of hours, but not longer than that.
Now, you and I were talking a little bit off camera that many times people associate strokes with being older, but it actually can happen to anyone at any age. Is this true?
Yes, it can happen to anyone at any age. And why it happens usually as you age is because this starts from damaged arteries. So throughout your life, one is the years that you live, but also is the risk factors that you may have that would damage the arteries as time goes by. But there are some strokes that happen from things that might be independent from those risk factors, like damage to the arteries, tears and things like that. But then there's also what we're seeing is people are having the same risk factors that usually would start on your 40s, 50s,
Right.
at their 20s, 30s. So you have more leading years with risk factors that damage the arteries sooner.
And we're going to get into that, but that seems like it has a lot to do with lifestyle, correct? As we're seeing
Absolutely.
it younger and younger. Now, in fact, we have a short video featuring a patient who had a stroke at the young age of 23. Let's take a look.
I was in a class, it was a group class, about 10 of us, and it was being guided by a trainer. I got dizzy, and he asked me, he said, "Why did you stop?" I told him, "Because I got dizzy." I raised my arms, except this one went up and this one didn't. Within 10 minutes, the ambulance was there. Within 30 minutes, I was at the hospital.
When the patients come like that, the patient enters like a protocol that we have here at Baptist, like a stroke protocol, which gets like an emergent CT scan, a CTA, which is a CT to look at the blood vessels to identify exactly where the blockage is, and then to see if the patient would be a good candidate for interventional therapies, which would be basically mean that we're going to go up with this plastic tube up to the patient's brain, to the vessel that is blocked, and try to unblock it.
It was very, very scary waking up and not fully feeling the left side of my body, feeling numbness, feeling tingliness.
We were able to diagnose her as having dissection of the vessel, which is a little tear in the inner layer of the blood vessel that actually caused it to block, and that was the cause of it.
This can happen to anyone at any age, no matter what condition you live your life, no matter how healthy you are or unhealthy you are. I'm only 23. It happened while I was working out. When something's gonna happen, it's just gonna happen. I left the hospital feeling great. Today was the first day that I was able to run on the treadmill. That's the fastest I've moved in the last 2 months, and that was amazing. That was 4.2 miles per hour. I'm gonna write it down. I'm gonna write down the date because that was the most exercise or like cardio exercise that I've done within the last 2 months.
That's incredible, doctor. To see her recovery, I mean, so quickly, 2 months. Sometimes it takes stroke patients longer. So in Kimberly's case, what are some of the things that we should be vigilant about?
Yes, so her case is somewhat unusual for most people because she's so young and
active.
And active. This type of stroke that she had is when there's a tearing in one of the arteries. So the artery actually got injured. We can see that sometimes in younger people. It's a disease of more younger folks. So you have to really be aware of the symptoms and know how to recognize them. In her case, she was able to know someone thought about stroke very fast. So EMS was able to bring her to the hospital really fast as a stroke, and were able to give her treatment. So the clot was removed, the artery was opened, and the amount of brain damage that she had was minimal. You can see she's done remarkably well.
So let's talk about some of those symptoms that you might feel during a stroke. And as she mentioned, one of them, she says, I tried to lift one arm, but the other wouldn't move. So let's start with that weakness in the face, arm or leg.
Correct. So you have to remember that stroke is an area of your brain that's damaged, and the brain is what lets you interact with your environment. So anything that your brain normally would do, once it's damaged, you can't do. So you might not be able to speak. If we go by the FAST here, weakness, so you might not be able to move or have weakness on an arm or a leg. Is usually one side, so left or right side. You might have difficulty walking, loss of balance.
Right.
You might be confused, have difficulty speaking or understanding language. You might not be able to see. You might have a very severe, sudden onset, worst headache of life scenario as well. But if you go by FAST, so you don't see the acronym there, but I don't know if we have it. But if you go by FAST, is face, arm, speech, and then the T is for time.
Okay. Because you have a certain amount of time to get.
That's right, and you only need one of them. You don't need all of them. So you either have face weakness, arm weakness, or leg weakness.
So
Speech,
you do necessarily get all the symptoms at the same time?
No, you don't necessarily get them all.
Okay.
You might just have problems with your arm, and your speech might be fine, and maybe the face will look fine, but even you just need one of those to think about stroke and then go to the hospital.
Okay. And this is a question that I have. I know obviously it affects certain parts of the brain, certain parts of your body. Is there a worse area to have a stroke in? Or
well, yes, there's areas of the brain that have very specialized function. Okay. And if you have those being affected, then the damage is more noticeable and could affect you more. So motor things, ability to move, but then language, vision, so all those are prime brain real estate, to put it that way. So yeah, those can definitely cause much more damage than if you have a stroke on a smaller area that just does association things.
Right. Okay, so coming up next, we'll be shifting gears to talk about another neurologic condition that affects nearly 50 million people worldwide, dementia. And we'll be discussing what it is, what causes it, and how it's even linked to stroke. You're watching the Health Channel, all health, all the time, on South Florida PBS. If you have a question for Dr. De Los Rios, please call in using the toll-free number, 855-796-4475. And please be sure to visit our website, allhealthtv.com, where you can watch a live stream of the Health Channel and watch videos from previous episodes. We'll be right back. Welcome back to the Health Channel, all health, all the time. I'm Kathy Buccio, and with us is Dr. Felipe De Los Rios, neurologist with the Baptist Health Neuroscience Center. If you have a question for Dr. Felipe De Los Rios, please call in using the toll-free number, 855-796-4475. We'd love to hear from you. Dementia is a major neurocognitive disorder that many people face, which causes brain function to progressively decline over time. Now check out this video from the National Institutes of Health that explains more on dementia.
Dementia is an umbrella term for the loss of cognitive function associated with a number of neurological conditions such as Alzheimer's disease, Lewy body dementia, Huntington's disease, and traumatic brain injury. This loss of cognitive function results from the death of once active nerve cells in the brain. The common thread between these conditions is the loss of a person's ability to think, remember, and reason. Symptoms of dementia often include difficulties with visual perception, language skills, and ability to pay attention. Some people also suffer from the inability to control their emotions. There are many causes of dementia. Some dementias are reversible, and some are progressive. Dementia caused by infections, metabolic disorders, nutritional deficiencies, and poisoning may be reversed with appropriate therapy. However, progressive dementias such as Alzheimer's disease, vascular dementia, and frontotemporal dementia only get worse with time. So being diagnosed with dementia is often a frightening experience. The diagnosis affects not only the patient, but also their families, loved ones, and caregivers. Furthermore, many individuals have what is referred to as mixed dementia, meaning they suffer from multiple causes of cognitive dysfunction, and often the cause of dementia is not known. The major risk factor for dementia is age. Although dementia is not a normal part of aging, and many elderly people maintain high levels of cognitive function well into their 90s.
This is definitely a little frightening, especially I know myself, it affected my family. My grandfather had dementia. So I want to dig a little deeper, doctor. What is dementia exactly?
Right, so dementia is, like it said, a neurocognitive disorder, so it's a neurologic problem that leads to progressive loss of cognitive function, and that can have different domains. Memory is one of the most common ones that people would notice, so people ask the same question over and over or don't remember recent things that have happened, but it affects different things. It affects language, it affects visuospatial, knowing where things are, how to get to familiar places, faces at the end. Right, very advanced dementia, people don't recognize other family members. But there's different things that cause dementia. So dementia is what we call a syndrome. It encompasses different illnesses.
Mm-hmm. So what are some of those things that can cause dementia? I mean, in the video, it said that there's not one particular thing that causes it.
Correct. So there's reversible causes of dementia, which is one of the things that we would screen for in the office, things that we can somewhat easily treat that would lead to better cognitive functioning, deficits of vitamin B12, for example, or if your sugar is too high, or things like that. And then you have the more progressive dementias. And the most common disorder that causes dementia within that category is Alzheimer's disease. So Alzheimer's disease is about 60-70% of all dementia causes. Mm-hmm. And then you have about 15-20%, which is vascular dementia. And these are basically strokes, small areas of brain infarcts that progressive over time, just you start losing brain tissue, which leads to dementia. And then there's other ones like Lewy body dementia and some other more rarer causes within that bucket as well.
Let's talk about the different brain functions that may be impaired by dementia, and we can take a look at those. The first one is memory. It affects your memory, as you mentioned, start forgetting things, little things here and there, and then communication and language. Can you talk about that, Dr. De Los Rios?
Yes, of course. So usually what happens with memory is that people have a difficult time remember recent things. They will remember very well things that happened in the past. So things that happened in their childhood or when they were young adults, they would remember. And some people say, well, but he has great memory. Look, he remembers all this. But then the problem is the recent things.
Right.
Communication and language, people can have difficulties finding the right words, expressing themselves, understanding what other people are saying. Ability to focus and pay attention, they get very easily distracted. So it might be very hard for them to focus on things that are happening at the same time. Mm-hmm. And maybe they're doing something and then there's another distractor and then they stop what they're doing and then they start focusing on something else. Reasoning and judgment, so it's very easy for them to get confused as to what is exactly what's going on and thinking the concept of what you're talking about. And visual perception talks about understanding, for example, just to put it in maybe a bit more understandable terms, the tree and the forest, right? You might be able to focus on the tree,
right,
but not see the whole picture, not see the whole forest, the details of what's happening on the sides, that sort of thing. Visuospatial, navigating to a place, understanding the 3D concept.
And I think that when you talk about the interruption of brain function, when you mention one of these, frustration comes to mind. And I think that's often, as we saw in the video, there is that frustration, there's mood change because that person feels like they're not being understood or they're not up to speed like they used to. Is that something that you often see?
Correct. That can definitely happen. So there can be personality changes. There can be behavioral issues, especially as the dementia progresses
Right.
and gets more into an advanced stage. People can be very frustrated because they're not being understood, or they can't communicate what it is that they want or need. Especially at the beginning, when it's starting, people will notice and they'll say, look, I have problems remembering this or that. That's what goes into what we call mild cognitive impairment. So that in itself is not dementia per se.
Right.
Most people, as the dementia advances, they don't have a problem. It's not about them. It's this crazy person that's bringing me to the office because they say I don't remember things, but I remember perfectly.
Right.
So
it becomes a family issue.
right,
as well.
it definitely does. The person might not understand that they're having memory difficulties.
Right.
They might not understand that, but the family definitely picks that up.
Right. Now, we did touch upon some of the possible causes of dementia, but I want to go over the risk factors for dementia now. So will you walk us through these, Dr. De Los Rios, some of these risk factors for dementia?
Correct. So these are all things that can lead to stroke as well.
Okay.
And also damage to the brain tissue damage. So dementia is a progressive loss of either the amount of brain cell neurons that you have or their function. So it's not working properly. So cardiovascular conditions will lead to stroke, which then leads to brain injury. Physical inactivity is also a risk factor for stroke and cardiovascular disease for the same reason. Social isolation. So educational level, engagement, keeping your brain busy of sorts. We've all heard about memory games and things like
Right.
that. But it gives you what we call brain reserve. So you have more brain tissue to lose and still function appropriately.
Whereas
so
someone-
that's what it gives you.
So if someone who is not engaging socially maybe doesn't have that much brain tissue, correct?
So it goes back into that, yes.
Yes.
So it's they might not have not only not social engagement, but they might not have a good educational level and things like that. And then whatever injury that you have, it just manifests itself more because you have less reserve. Head injury, again, going back to brain injury, sleep problems are tied to stroke and cardiovascular disease as well, and poor diet is tied to cardiovascular disease and stroke as well.
Wow. Now, earlier this hour, we talked about stroke. So now let's focus on the relationship between stroke and dementia, which I think is fascinating. Now, earlier this year, a new study came out suggesting that people who've had a stroke face up to twice the normal risk for dementia. So can you tell us a little bit about this study? And as I mentioned, you and I were discussing, and I think this is mind-blowing.
Correct, and it's very important that people are aware of this.
Right.
Because dementia, once you do have this progressive dementia, there's no good treatment. There's no disease-modifying treatment that we can give you that will lower the speed at which the dementia will progress. So really, you have to focus about prevention. And one of the things that you can definitely do to lower your risk of having dementia is lower your risk for stroke and heart attack.
Right.
So there was this study, the title of the study is called Vascular Risk at Younger Ages Most Strongly Associates with Current and Future Brain Volume. So it's talking about the amount of brain that you have. So that was published in Neurology. Matthew Passé, might not be pronouncing that right, but anyway, he's the leading author on this. And it's from the Framingham Heart Study. So
Okay.
this is a town in Framingham, Massachusetts that was followed since 1948.
Wow.
So now we have 40 years or so of data that was looked into this study. And basically what they saw is that if you have more risk factors for stroke and heart attack when you're 40s and 50s, that correlates with the amount of brain volume, so the amount, and that's a surrogate of your neurons that you have at the time of the test and then further down the line. So the highest your risk factors in your 40s, 50s, especially if they're not controlled, then the lower your brain volume later in life. And you can imply from that your higher risk of dementia.
Right.
And so this relationship was attenuated over time, and that makes sense. So if you have risk factors when you're 70, 80s, then your risk of having a lower brain volume or dementia will decrease because you have less time with those risk factors. So basically what this is going back to is when you're 30s, 40s, 50s, and you feel good and you don't have many reasons necessarily to go to the doctor, you should definitely go to the doctor. Because if you have high blood pressure, high cholesterol, diabetes, things along those lines, you smoke, drink too much alcohol, if you are able to control that, if you have those at that age,
Right.
your brain, your healthy brain aging is going, it's really going to affect how you are at your 70s, 80s, 90s.
Right, and puts you at higher risk for dementia as well.
Absolutely.
Wow.
Absolutely.
Now, so far we've learned a lot about strokes and dementia, including the association between the two conditions. And up next, we'll be discussing how to prevent them, including lifestyle changes you can make today. You're watching the Health Channel, all health all the time on South Florida PBS. If you have a question for Dr. Felipe de los Rios, please call in using the toll-free number 855-796-4475. And please be sure to visit our website, allhealthtv.com, where you can watch a live stream of the Health Channel and watch videos from previous episodes. We'll be right back. Welcome back to the Health Channel, all health all the time. I'm Kathy Buccio, and with us is Dr. Felipe de los Rios, neurologist with the Baptist Health Neuroscience Center. If you have a question for Dr. de los Rios, you can call in using the toll-free number 855-796-4475. Now, stroke is the 5th leading cause of death in the U.S. and the 2nd leading cause worldwide. But it's a problem that can often be prevented. So check out this short video where Dr. de los Rios gives an overview of reducing stroke risk.
It's important that we all realize that stroke is a preventable disease. There are 7 basic things that you can do to lower your risk of stroke. One of them is having your blood pressure checked, make sure that you don't have high blood pressure. 2 is having your blood glucose checked, make sure you don't have diabetes. And if you do, that it's well managed. 3 is following the diet. There's different diets that can lower your risk of stroke. One of them is the DASH diet. The other one is the Mediterranean style diet. 4, making sure that you're not drinking too much alcohol. 5, staying clear of tobacco. 6, making sure your weight is where it needs to be and you're not overweight. And 7 is being engaged in exercise. So we know regular exercises will decrease your risk of stroke.
These are all great tips, doctor, not just for those at risk for stroke or dementia, but for all of us as well. But so I want to talk a little bit about that. And you also say that if you reduce the risk of stroke, you reduce the risk of dementia. Is this true?
Correct. Yes. By reducing your risk of having stroke, which is small areas of brain damage, sometimes large areas of brain damage, all of a sudden you do reduce your risk of having dementia down the line.
Okay. We have a caller on the phone. We have Annette from Miami. Annette, are you there?
Yes, I am.
Hi, Annette. How are you?
Hi, Ed.
I'm fine. I have a question for the doctor, please, about my dad. He's about 60 years old, and maybe older than that, like 61, 62. He's still very, very active, but he had a small stroke about 4 years ago, and he recovered. He had some damage initially, but he recovered fully and went back to work, and he's doing great. And then 4 years later, he had another stroke, like maybe 6 months ago. And in those 4 years, there's been nothing that's changed. He's still healthy. They thought maybe he had atrial fibrillation or some kind of heart rhythm disorder because they couldn't find any good reason. He doesn't have high cholesterol, doesn't have high blood pressure. And they found something around his aorta, but they can't seem to find a place where his blood is pooling. Can you figure out any other reason why he might be having a subsequent stroke?
That's a great question.
Well, yes, it's a great question. And 1 out of 4 people that have had a stroke might have another one throughout your lifetime. And it goes a little bit back into the risk factors when you're in middle age as well, because as you age, those risk factors, and I'm not saying that this might be specifically in your case, but or in your father's case, but high blood pressure, diabetes, that sort of thing, tobacco, etc. In your middle age, as you you age, then the arteries start getting damaged, and then you have more chances of clots forming or the arteries failing and then getting strokes. Right. So if you already have that, it's like if you have a house and the pipes are already somewhat damaged, you have a higher risk of that happening again and again. The good thing is that by controlling the risk factors, you will lower your risk of stroke. I might not go all the way to someone who's been protecting their arteries all throughout their life, but you can definitely lower the risk. And then there's this other group of conditions that can happen that can increase your risk as well. So one of them that was mentioned was atrial fibrillation. And that is a heart condition where part of the heart, the auricle, just kind of shakes or trembles a little bit, fibrillates, and doesn't contract all the way. And that can happen for 30 seconds, 1 minute every 4-6 months, but blood pools on that area, and when blood that pools then forms a clot, and then when it does get squished out of the heart, it can go anywhere and give a stroke. So that can sometimes be hard to diagnose in the hospital. There's different sorts of monitors that you can place underneath the skin that will look at your heart rhythm. So this is underneath the skin, not on your chest wall or close to the heart. But they will monitor your heart rate for 2-3 years. And we know that that can detect more atrial fibrillation on those patients that you have a high suspicion for. Then there's also what you had mentioned, some plaques. So you can have plaques of fat, which we call atherosclerosis, and you can have that on the arteries. It can be in the arteries of the neck. We showed that, an example of that earlier in the show. But it can also be on the arch, on the aortic arch, so close to the heart. And when you have that plaque, blood that gets into contact with that also forms clots to try to repair that process. Doesn't do that very well, but that clot can then be pushed downstream and produce strokes. And there's different medications that you can use to lower the risk of that. There's what we call cholesterol-lowering medications, statins. There's antiplatelets, aspirin, Plavix, things along those lines. That will help lower the risk. The risk doesn't go all the way down to zero, though. I mean, no one has an absolute zero risk of having a stroke, but all of those things lower the risks. And then there's some other rarer causes that needs to be screened for if people are having recurrent strokes despite everything looking fine, the study is looking okay. So there's some definitely a group of disorders that are on the more strange side that need extra testing as well. Hope that helps.
Thank you so much, Doctor. And thank you so much, Annette, for calling in with your question. Now, the American Heart Association has 7 steps to good cardiovascular health called Life's Simple 7. So let's go through these steps. The first one is stop smoking. So, Doctor, we keep saying it again and again. How important is it to quit smoking? It doesn't matter how late in life, just quit.
Absolutely. So this is a great way to look at what increases your risk of having stroke and heart attack and how to minimize that. So smoking is one of those things. And if you look at some of the statistics, 6% of adolescents, 12 to 17 smoke, 19% of men throughout their life, 15% of women. So this is one of those things that we have a lot of data on now, and we know that will increase your risk of having a heart attack because it damages the arteries not just of your heart, but everywhere. So it increases your risk of having what we call peripheral vascular disease that lead to limb amputations, but also on your brain. And the correlate of that would be stroke. So there really isn't a reason why anyone should be smoking, and this is one of those easy things. Well, not necessarily easy because it's definitely very addictive, but it's one of those things that if you can actively stop, it will help your health tremendously down the line.
Now, we talk about things like eating better, getting active. And by eat better, I know that you as well mentioned in your own video, a Mediterranean diet. So does this apply as well to a brain healthy diet? Absolutely. So there's 2 ones that we have quite a bit of data on, and you can go online and search for them. The American Heart Association has some great resources on that. One of them is the DASH diet and the Mediterranean style diet. And both of those go for lower salt, less sugars, sweets, processed foods, lower meat, more fruits, vegetables. So if you want to have more specific information, you can definitely go online. You get lots of resources regarding both of those diets. Okay. Now, Doctor, I want to definitely read a viewer call that we had, and her name is Estela, and she's trying to find help for her. Correct me if I'm saying this wrong, but amyloidosis. Is this true? Okay. And she said that the condition went to her blood vessels in her brain, and she wants to know what her options are. So, are you able to give Estela
Right.
some direction.
So cerebral amyloidosis is one of those on the rare, somewhat rarer category. So we don't mention that on the Life Simple 7 or things like that.
Right.
It's a more rare disease. It's amyloidosis. It's a proteinaceous, insoluble material that builds up in the brain, specifically around the arteries and the brain tissue around the arteries, and it can cause damage to those arteries, and it can lead to stroke, and it could also lead to hemorrhage.
Is that common?
It's not terribly common. I mean, we do see it somewhat in the hospital regularly, so it's not something that we rarely see. We
Okay.
do see it, but the vast majority of people do not have this condition.
Okay.
And we don't have great treatments to modify the disease themselves, so we don't have disease-modifying therapy as such that will prevent the protein from developing or building up around the arteries. We do have different strategies to mitigate that risk. So that the risk of having another stroke or brain bleed are less. But unfortunately, I mean, there's lots of research, and we hope that we'll have something soon, but as of now, we don't really have that.
Okay. So in her case, just maybe the simple 7s. Keep practicing those.
Absolutely. So lowering your things that you can modify will definitely go a long way. That will definitely help. So that is a must. And then trying to minimize exposure to unnecessary maybe medications that would increase the risk of bleeding. So sometimes we'll prescribe aspirin, Plavix, things like that for a regular stroke.
Okay.
But for something like this, we typically try to avoid it because you can also cause bleeding.
Now, coming up next, we'll be talking about what to do in case you or someone you know is showing signs of a stroke and why it's important to act fast. You're watching the Health Channel, all health all the time on South Florida PBS. If you have a question for Dr. De Los Rios, please call in using the toll-free number 855-796-4475. And please be sure to visit our website, allhealthtv.com, where you can watch a live stream of the Health Channel and watch videos from previous episodes. Don't go anywhere. Welcome back to the Health Channel, all health, all the time. I'm Kathy Buccio, and with us is Dr. Felipe De Los Rios, neurologist with the Baptist Health Neuroscience Center. If you have a question for Dr. De Los Rios, please call in using the toll-free number 855-796-4475. Now, Dr. De Los Rios, I am still fixated on this caller that called in, and I want to ask you, so the patient or the caller had their relative a stroke 4 years earlier. 4 years later, they had another one with no signs of high blood pressure, cholesterol. So in the meantime, what does a patient or someone like this need to be doing while they figure out what's causing the stroke or to prevent another stroke? Is this something where, as you mentioned earlier, there's different medications? Could it be aspirin? Could it be blood thinners? Because like I said, this person has an active lifestyle, no other signs otherwise.
Right. So it's very difficult to say to one specific case because there's much more data that would need to be known. But in general, what we want to target are the things that we mentioned as blood pressure, making sure there's no diabetes, also your cholesterol levels, exercise, those sort of just general measures to prevent stroke and heart disease. Now, on top of that, if you already had a stroke, we'll typically prescribe what we call an antiplatelet, which is a medication that makes it a little bit harder for the blood to form clots. That is usually either an aspirin or Plavix. There's different medications, a combination of aspirin and dipyridamol that you can use. We typically use just one in general, again, unless there's something specific like atrial fibrillation, in which case we'll use an anticoagulant, and there's quite a few anticoagulants now in the market. On top of that, we typically recommend a cholesterol-lowering medication. And your cholesterol might be fine within normal limits, but if we see evidence that there is some fat buildup, like in the aortic arch or on some of the carotids or so, then even if your cholesterol is within normal range, these medications help lower your risk of having another stroke.
Now, another thing that you and I were talking about is I wanted to bring up the things that we cannot change, unfortunately, age, genetics, medical history. So how much of that plays into something like stroke and dementia?
Correct. So there is a lot of things that we can't change. Fortunately, at least for stroke, and really, truly for dementia as well, 80% of stroke is preventable. So there's a lot of things you can do. You're not really bound by your genetics and have this sentence throughout your life. There's a lot of things you can do to lower your risk. But you have to pay special attention if you do have multiple first-degree relatives that have these conditions because your risk is likely going to be a little higher. But you can definitely act upon that. So things that are generally not modifiable for a stroke, for example, we know African Americans, Hispanics can have more strokes than non-Hispanic whites. Also, women tend to have stroke a little more than men do as well. If you have, for example, in the case of dementia, if you have a first-degree relative with dementia, especially if it's less than before age 70, your risk doubles or quadruples of having dementia. Now, only 2% of all dementia has a known genetic etiology that we know. So we can tell you if you have this specific gene mutation, then your risk of dementia is quite higher. That's 2%. So most of it is not. But having the family around you, if they have these conditions, you definitely have to pay attention specifically to the things you can modify. Think a lot. There's lots of things you can modify.
Now, I had read, Dr. De Los Rios, that the risk is higher for women over the age of 55, and that women over the age of 55 should be taking an aspirin every day. Is this true? Do you recommend that, or do you think?
So it is true that the risk is higher for women over 65, and there's different things, hormonal changes that play into that, aging, as well as the age of the life expectancy for women versus men, amongst other things. And there are some studies that say that taking a baby aspirin or so can help lower your risk. However, there's been a more recent study that looked at people without cardiovascular disease, so there's sort of healthy individuals that are older, greater than 60, and there really wasn't a benefit for just taking a baby aspirin just out of the blue without any specific indication. Aspirin does have some side effects as well, like any other of the antiplatelets do, so it does increase the risk of bleeding and the risk of forming ulcers and things like that. So the recommendation for now is if you have no cardiovascular disease, to not necessarily be taking an aspirin or an antiplatelet just out of the shelf. But focus on the risk factors for sure. So you are going to have much more impact by watching your diet, not smoking, doing exercise, making sure your blood pressure and your sugars are okay, and all of that, than by taking a baby aspirin.
I want to bring up the graphic, our FAST graphic that we were talking about earlier, because I think the rest of what we're going to be discussing is tied to that, which is let's get medical treatment for these strokes. So if you're having a stroke, it's imperative that you get to that hospital quickly, but don't drive yourself.
Yes, so a stroke is a brain problem. So if you have a stroke, most likely you're not fit to drive.
Right.
So that's one thing, you can get into an accident. But the other one is that by calling 911 and going by EMS, you're going to arrive right away at the hospital, but you're going to arrive to the right hospital, because not all hospitals treat strokes appropriately, or I should say not appropriately, have the right resources to treat a stroke. So there's different levels of certifications. There are hospitals that can be certified as a primary stroke center, and they can provide the basics. But then there's also the comprehensive stroke centers, and you wouldn't necessarily know which one is which and which one is right for you at that time. But EMS has a whole algorithm for that.
Doctor, before we wrap, I do want to get to two forms of treatment which I want to discuss: thrombectomy or a drug called TPA. Can you break those down for us?
Absolutely. So imagine you have a clog pipe. I'm just going to go do an analogy here. If you have a clog pipe in your house, if the clog is small, you can put some chemical and open it up.
Right.
Okay, so the chemical is called TPA for the body, which destroys fibrin, which is what binds together the clot. So if the clot's small, that works pretty well. However,
and that's non-invasive.
That's that's an IV medication.
Okay.
However, if the plug is big, no matter how much chemicals you pour down that pipe, it's not going to open, right? So for that, there's more mechanical devices that you can use to remove that clot. That is what we call endovascular therapy. So the interventionist will go through the groin, up through the artery with a small plastic tube, reach the clot, and then there's different tools that you can use to extract and remove that clot, so blood can again flow to the area of the brain. So those are the two reperfusion therapies that we have, so that the brain can again receive blood.
Absolutely, and that
very
is
time dependent, though.
Very time dependent.
Very time dependent. So we're talking hours. So the sooner you get to the hospital, the faster you can get the treatment, the better the outcome is going to be, because the area of damage is going to be smaller.
And what is that window again, doctor?
So we like to say fast as possible, right? So people don't focus, oh yeah, it's been already, this amount of time, then I can, lay back. No, you want to get as fast as you can, but it can reach out to 24 hours now.
Okay.
So we have evidence, and we will offer this therapy to individuals out to 24, but more people qualify for the therapies at 2, 3, 4, 5, 6 hours than at 24.
Incredible. Thank you so much for being here, Dr. De Los Rios.
Thank you.
Be sure to join us next time on the Health Channel, All Health All the Time, on South Florida PBS. Follow us on Facebook, Instagram, and Twitter at All Health TV, where you can get health tips from our experts and see what's coming up on the Health Channel. You can also visit our website, allhealthtv.com, where you can watch a live stream of the Health Channel and watch videos from previous episodes like this one. I'm Kathy Buccio. We'll see you next time.